Hi, Adam Rosen back here again. I want to talk to you about something pretty short and sweet, but very important, and it's what I call sit, stand, and go. So, for a lot of my older patients, especially if they have heart conditions or blood pressure problems, they may have had episodes where they stood up too soon and they got lightheaded and dizzy. And many people have started to learn that they can't get up that quickly, that they have to do it in a stepwise fashion. For other patients, especially my young active patients, I have to reiterate this to them that in the beginning after surgery, you should go through this same sequence of sit, stand, then go. And the reason is that when you have surgery, there's anesthesia. And when you have surgery and pain, there's medications. And when you have surgery, there's blood loss. And all three of those in combination can decrease your blood pressure or decrease your body's ability to raise your blood pressure up to normal when you get up to go. So the mistake that people don't want to have happen is an accident because you got lightheaded and dizzy and passed out after surgery and then fall onto your freshly operated knee. So to prevent this from happening, what I recommend to people is that when you get up, and I even tell them in the hospital, the day of surgery, even if you get up and do great with therapy, do not get out of bed by yourself. Buzz one of the nurses or aides so they're near you. And when you get out in the hospital, or when you go home for the first 2 or 3 days, when you go to get up, sit up. Once we sit up, our blood pressure changes a little bit. You might even squeeze your muscles, like squeeze your arms, your chest, your legs, to kind of get those muscles flowing. And then stand up. If you're still using a walker, stand up and put your hands on the walker and stay there. Because if you get lightheaded or dizzy, you can just sit back down. There's a bed underneath you, or if you got out of a chair, there's a chair behind you. Just sit back down. But you don't want to get up and go, because if you stand up and go, and now you take 5 steps into the middle of the room, and now you're lightheaded and dizzy, what are you going to do? More than likely, you're going to pass out or fall down or get dizzy and hurt yourself. So in the beginning, and you're not going to have to do this for a long period of time, but when you're in the hospital and when you go home, just make it a habit that when you go to get up, sit up, maybe flex your muscles a little bit, stand up, wait there 20, 30 seconds, and then go. And this hopefully will help you. It'll prevent the dizziness, but more importantly, it will prevent an accident like a fall. Thanks again for listening. I'm Adam Rosen. I'll see you next time.